Okay.
If you're tuning in to the live stream, I'm sorry,
Okay.
everyone. It's not the one that's the actual link.
I don't know if my Instagram is gonna work. It kind of
Mine just
looks
turned on.
okay. Maybe there's a
So I'm going to
delay.
hit go live on Instagram. Okay. My live video on Instagram is frozen, but I don't know. It came on, so that was something. I have not seen us yet on YouTube. If we're actually on YouTube, I'm sorry for these technical difficulties. One of the platforms we were planning on using today was like completely dead. Like no, like you can't even get on their website. It is like completely off.
Yeah.
So,
But you're live on Instagram right now, I think.
am I? Can you see me on Instagram?
I got a little notification on my phone.
Okay. Yeah, it's I guess Google's Cloudflare or something like that is having problems. There's like outage tens of thousands of outages reported.
Oh, really?
Yeah. Let's see here. Man, yeah, so that's why the YouTube link we were going to use actually doesn't have anything on it right now. So,
Oh,
um,
interesting.
yeah.
Okay, it looks like our YouTube's working.
Is it? Okay.
Yeah. So I would say that's pretty good.
Okay. I think. Yeah, I don't see. Do you see the YouTube chat?
No.
I don't either. So usually I thought it pops up in here when we have a chat. Okay. 3 people are at least logged on for the YouTube one. So sorry, everyone. We're working through a couple technical things here as we had called an audible on the technology, the streaming software that we usually use, which we're switching over to this one, which it looks like might be working on Instagram. So thank you all for bearing with us. Just going to get confirmation. Yep. All right. Chris says we can see us on Instagram, so that's good. I can't. My
Right.
preview on Instagram is gone, but I do see people joining in. So thank you all. Thank you for bearing with us. We will get started in just a minute, less than a minute. All right. I'm just going to tell Chris I can't see any YouTube chat stuff, so he'll have to pass it to me.
Okay.
All right. So I let Chris
Okay.
know if there's any YouTube chats to, ping me a notice. But all right, let's get going. So welcome everyone. Thank you for joining us. Thank you for bearing with our technical difficulties. We are just 2 simple surgeons who do care deeply about helping people with their weight loss. And yeah, we're excited that you're joining us. And we can talk about anything you want to talk about. We've had actually quite a bit of pre-submitted questions that people would like to discuss. Most of them are relating to the endoscopic sleeve, the endosleeve, the ESG, the endoscopic sleeve gastroplasty that we have been doing for 5+ years now, which is cool. But yeah, so Dr. Tan, get us started off. Introduce yourself.
Yeah. I'm Mimi Tan, bariatric surgeon, and this is going to be exciting. Yeah. So I guess if we're talking mostly about endo sleeves today, I started endo sleeves when I joined this practice about a year and a half ago now. So a little bit newer, but you've been doing them for quite a long time now. Um, and I'll brag about you for just a second because I know you won't do it, but you have really been the person on the West Coast doing these ESGs. And so you've done more probably than anyone, at least on this side of the US. And so you've really done a lot of good work there. And your numbers have looked amazing in terms of outcomes for patients. So that's awesome.
Oh, thank you.
Yeah.
That's nice.
Yeah.
Yeah. Cool. Thank you for saying those nice words.
and you like train other surgeons and
I
other
do.
GI
Yeah.
docs.
I think I
So
have I think I'm one of the I think I have some of them, there's only yeah, I've trained quite a few people on how to do this. And I love that part. Like it keeps me up at night thinking about how do I make this surgery better? How do I get people the best results they possibly can? How do I train other people to do this as well? Um, because it's a challenging procedure.
yeah,
It's
yeah,
challenging to do well, which I love. I love the challenge, and I love like getting better at it. I like you know
yeah.
I joke. I watch a lot of. Do you watch a lot of film? I think my wife could actually probably do an ESG by how much and ESG she's watched, just by how much film I watch. So. But yeah, if you're watching, dear, you're
Well, I
welcome.
feel sorry for her.
You're welcome to give some shade in the chat line. So, yeah. Brandon Vanderwell, I've been doing ESGs, endoscopic sleeves for over 5 years. It's been a really cool journey. We were one of the first practices, one of the first people in the Pacific Northwest to do these procedures. And that was right during COVID time. It was a crazy time, but it's been really cool. And it's been, really a great tool for so many patients. These are tools. They're not cures. They're not magic wands. So, yeah, but it's a really cool tool. It's an endoscopic suturing device that actually goes on the endoscope and it goes down through your mouth into your stomach, and then your stomach, which is this big bag, takes these little bites there and then collapses this part down so that your stomach is nice and small and tight. And just it reduces the surface area of contact of your mucosal area. That's the hormonally active part of your stomach, and it also decreases the size that it is available to fit more food in. And it's been very helpful in our practice. Generally, we see low 20% as our average. That is average. Of course, there's people doing above and below that, but those are very solid numbers. Those are really very real numbers. Numbers we see better results with our endoscopic sleeves than our GLP-1s, particularly at 2 years. For 2 years, generally our GLP-1s are, if you have a normal stomach, it's tough. It's tough sledding out there at 2 or 3 years. But the endoscopic sleeve is a really nice tool for that stuff. So
Yeah, yeah.
I got a little thing on here. It says there's a chat on here, but that's a good question where I see the chat.
I think it's if I want to chat with you, but I might be.
Oh, really? Because I have this thing that says chat 1 up here on the chat, new messages.
Yeah, no, I see that too. I don't know what
Yeah, I don't know what that means, and I don't know where to find the chat.
Oh, it does. Oh, yeah.
Oh, chat. Here we go. Chat on the side here. Hi, doctor.
Maybe that is
from somebody. So
hello.
hello back, someone. So thank you for joining. Okay, let's go. Let's start cruising through these questions.
Yeah. Do you have questions?
Yes, I had one of the people from the endoscopic sleeve Facebook group asked me a question the other day that was, do you there are some people out there that get an endoscopic sleeve gastroplasty, the Endosleeve, from other programs, and their programs have them do what I understand is like 45 days to 6 weeks of a liquid diet, which is yeah, I know that's out there. And what I heard actually through the was actually like a clear liquid diet, which would be really surprising.
Oh my God.
Clear liquids is actually very challenging to get enough protein in.
And 60 days? That's
yeah. Well, it's 6 weeks. 6 weeks.
Oh, 6 weeks. That's still longer than.
So
okay,
yeah, 45 days, 6 weeks. Which I hear there's a number of people out there. I know when I teach the courses, I listen to other people's programs, stuff like that. We usually sit in a panel and we describe what our programs are like and different things of why we do things. There are 6 week liquid diets out there. I told them, I was like, guys, the compliance on 6 weeks of a liquid diet is probably really low. Like 6 weeks of liquid is brutal. That's a long, long time. In our program, we're usually like a week, 7 to 10 days of liquids. The first 2 to 3 days, we like you to do clears and then progress to full liquids, which means like protein shakes, things like that.
Oh, this is after
surgery. Yeah.
Okay. At least that makes some stuff. I thought you meant beforehand.
6 weeks before surgery would be.
I was like, that's insane.
Super brutal, especially for an Endosleeve.
Okay, but that's still that's still a long time. Jeez. Okay.
Yeah, it's still a lot. Yeah. So it's
Yeah. Those people have never tried to do a liquid diet for longer than probably a day.
Yeah, I wonder,
Honestly.
and I don't when I wonder when they see people, if they see people post-op or if someone else sees them for them. Because I mean, when I usually am, I try to be fairly merciful. And if someone's getting their, if they're 60-60, right? 60 fluid ounces, 60 grams of protein by the week after I see them after their procedure, I generally liberate, I say, hey, you're ready to go on to purees. Let's do it. Let's make your diet more. And they're like, oh my gosh, thank you so much. I don't think I've
Yeah.
ever been so happy to eat pureed food in my entire life. So
Yeah. Yeah.
six
Most
weeks
people
is
are
a
already
long
over
time.
it.
That's a long
Yeah.
time. Yeah.
It's a lot of.
I give people a video ahead of time, and I try to tell them here are the tips for to being intentional about getting the amount of fluid in that you really need to get, and that is literally set the timer on your phone for every 10 to 15 minutes and then every time that goes off, just take a little sip. And if you want to make it really straightforward for yourself, this is not quite a liter. It's a little bit less than this, a little bit more than this. But if you have like a liter water bottle, pour your protein shake into it, fill the rest of it with ice or water. You drink one of those in the morning, you drink one of those in the afternoon. 60-60. You're golden. You're right there. And then we can just add, and then as you go into purees, you just keep doing that 60-60 there, and then you add a little bit of other purees for fun, just small portions. We're talking like less than a quarter cup of refried beans, cottage cheese, maybe a little bit of peanut butter, and your life is great. It's good. So
Indeed. Indeed. All right.
Yeah. Thank you for everybody for tuning in. If you have any questions, feel free to put them in the comment section. We got some pre-submitted questions. We're gonna just keep chugging through. So, Dr. Tan, that was the one that I heard beforehand. You're welcome to kick us off on the next one.
Yeah. Well, I think let's just back up a little bit and kind of go through what exactly is the endosleeve. Or
Sorry, I should probably finish the rest of our diet progression, I guess. So
that's probably good.
yeah. So
We're all like,
I
we
don't
don't
want to leave
do
you hanging.
that.
Like, what do we do?
Talk about
So it's
what we
like
do.
1 week, 7 to 10 days of liquids, and then it's usually about a week of pureed food. So pureed being like anything that like plops, like ploppable food. So this would be like,
Ploppable food.
yeah, the ploppables.
Okay.
Yeah, it doesn't
Okay.
necessarily keep structure if you when you put it in a kind of it doesn't
Ah,
it's sort of like you can't
like
really
the
make them
TSA
malleable.
would take that away from you.
Yes, yes. So, well, not that they'll take anything away from you.
They'll take anything away from you.
So, yet then that would be like cottage cheese,
Yeah.
refried beans.
Yeah.
What's actually a really good one? I had this the other a little bit ago. I did surgery on one of my cousins, and she stayed at my house afterwards. So
Oh,
I got to
really?
see the whole journey after surgery in real time, which was fascinating
That's so
and really
cool.
cool.
Yeah.
She did fantastic.
Good.
But my wife made some taco soup, which is actually really good. Just like taco ground beef, taco seasoning, some onions, some other stuff that you would put in a taco, and then we pureed it and down into that. And we did that was ahead of time before surgery because that's a little bit too much for a full liquid diet still. But that's actually really good. If you puree like a taco soup, that like that, I tried
Sounds
that
pretty
along too,
good.
and I was like, oh, this is good. This is
Sounds
not
pretty
this
good.
is
Yeah.
not bad at all whatsoever. Especially from a soup standpoint.
Yeah.
Then
Yeah.
we
You
go
get so
to
sick of the sweets by that
you
point
do.
that you just
Yeah,
want
you're
something
super sick
savory.
of sweets usually by that time. Um, and then a week of soft food, which is soft food being like anything that you can sort of if you push down on it with a fork, it should kind of go in between the prongs of the fork. You should sort of be able to more or less break it down with your tongue with minimal, breaking down with your molars. And then you'll progress about after a week of that, progress on to regular food. Portion sizes being the critical one, less than a quarter cup total. And about 5 to 6 instances of this, going for that 60-60, 60 grams of protein, 60 fluid ounces. And you are off to the races and feeling better than ever.
Excellent. All right. And that is the same diet progression that we do for all of our other bariatric patients, like people who are having surgery as well. So we just keep it consistent from that standpoint. Okay. Well, should we dig into
Let's go. Let's do it.
Okay. Well, I was thinking we should just talk a little bit more about for folks who've never heard of the ESG, don't know what the endosleeve is, and just like exactly what it is, and how it is different than the traditional bariatric procedures that we're doing. both in terms of like the logistics of the procedure, recovery time, where we do it, etc. Maybe the way I like to describe it to people who've never heard of it is that it's the incisionless sleeve, right? We're not, I think
Ooh, I
that's,
like that.
at least
Yeah.
when you leave us that day after your procedure, that's your takeaway, is that you do not have any incisions. We did the entire thing through the mouth into the stomach with an endoscope. Um, and the outcome is roughly comparable to a sleeve gastrectomy, where we take out 80% of the stomach. So at least the inside of your stomach hopefully looks similar to someone who's had their stomach removed. Um, but yeah, what is there anything else that you add on to that when you're
Yeah, I emphasize that. Yeah, there's no incisions. Um, Nothing is taken out of your stomach. Nothing's taken away. Like you don't remove any part of your stomach, which is really appeals to a lot of people. That they really a lot of people really like that aspect of the procedure. I tell people it's not all of these tools that we have for weight loss: medication, endoscopic sleeve, gastric bypass, laparoscopic sleeve. These are just tools. They are not cures. They're not magic wands, but they're really good tools and they're very helpful. The endoscopic sleeve is a very good tool. From our data standpoint, it is better than the GLP-1 medications like Ozempic and Manjaro. We're seeing better. We generally see better weight loss results with that. And then, but our laparoscopic sleeve is better than that as well. And it's pretty interesting that the tiered step there. What I tell people is the best tool is the one that you're willing to use. Try to always go for the most aggressive tool that you're willing to live with, because obesity sucks and it fights hard and it fights dirty, and so we need to use as strong a tool as we can. So,
yeah. Yeah,
but
and I think go ahead.
oh, and my messaging to patients is like if you're like, man, I really need help with my weight, but the surgeries just seem a little bit too spicy for me, but I'm willing to really consider the endoscopic sleeve. I tell them, do the endoscopic sleeve. Don't lose a minute of sleep extra after that. Like it's a really good tool. If you're not willing to do surgery, the next best thing is the endoscopic sleeve. It really, in our data, it's much better than the medication, and especially at 2 3 years, like your chance of being where you want to be is so much better. Like literally in our data, 75% of people that get an endoscopic sleeve are doing better than the 75% of people. The top the top 75% of people are doing better than the bottom 75% of the weight loss people. So
I like that, the spiciness factor. 2 out of 5 chili peppers versus 4. I don't know. Yeah. Okay. So, and I would also emphasize that it's a day procedure. So you have your procedure with us. You are pretty asleep for it. We have an anesthesiologist that's giving you medications. Um, and then, but you go home same day of your procedure. And then recovery, I tell folks like 3 to 4 days where you're feeling pretty
yeah.
icky,
Mm-hmm.
and then you're feeling pretty good after that.
Yeah.
So
And the nice thing is you can like a lot of my patients, they're back to work and exercise, within 7 days. So seven
yep,
to ten
yep,
days.
no like concern for hernias or anything like
Yep.
that. So you can start lifting,
Very nice.
which is really nice. And then I'll add on like, you know, the ESG is better than medications alone for sure, but also the medications are a really nice complement too. Like if you are like, I don't want surgery, but I do want to lose a little bit more weight than what the ESG typically offers, medications are a really nice thing that kind of pushes you past that edge or kind of pushes things forward a little bit too. So
And
we have a lot of
especially
tools
even people
today.
that are like not doing as well with the medication, we see them. The endoscopic sleeve plus the medication actually seems to help. Like
Yeah,
it does seem to break through a barrier there,
yeah.
and you do start getting to places that you haven't been before.
Yeah, yeah. I think that like, I'm sure there's gonna be a lot more studies that come out about this, but I think like physiologically it makes so much sense. It's hitting a different way of attacking like the weight problem. And so totally makes sense that they work synergistically in a lot of ways. So, which
Yeah,
is really, really
we're
nice.
in the and era. It's procedure, endoscopic sleeve, gastric bypass, and medication. I mean, those two together.
Yeah, we're in our combined surgery GLP-1 era.
Yep, for sure.
All right. Okay. in your mind, who qualifies for the ESG? Who is the best candidate for the ESG?
Yeah.
Um,
I usually, if someone has a BMI less than 30, I will potentially consider them if their BMI is like, 27 to 30 with certain stipulations being, what's your usual, what's been your traditional historical adult weight? We have a little bit more in-depth conversation, but I don't really, anybody above BMI 30, I have no hesitations offering the Endosleeve
yeah,
to. Like, it's a really good tool. It's very well tolerated. It's very safe. It's really nice. It
yeah,
works really well. And
yeah,
truthfully, like if you're doing Manjaro, even the compounded stuff right now, like you see the prices. Um, at 2 years, you're doing better than with an Endosleeve in its own right. You're doing better than the Manjaro people, and your price has been about the same almost now. Like, it's
yeah,
crazy.
yeah,
So, um, the so anyone above BMI 30, the people that have BMIs above 50 particularly, I always have a conversation with, hey, these are all the tools that we have available to us. Here's medication, here's what it can do for you, here's the endoscopic sleeve, here's what it can do for you, here's the laparoscopic sleeve and the gastric bypass, here's what they can do for you. Is this what sounds the best for you? Is this going to be the right thing for you? And
yeah,
like this is their life, it's their body. So I'm just here to
yeah,
make sure they
mhm,
know all the options.
yeah. Yeah, I mean, I would say, yeah, I think probably like sweet spot BMI at least is maybe like 30 to 35-ish for the ESG, give or take. Once you get into higher BMIs, probably surgery is going to be, it's just going to give you more weight loss.
Mm-hmm.
But again, depends on your goals and your preferences as well. And then an interesting thing I've been thinking about is kind of the ESG is almost like a maintenance tool for folks who've lost a lot of the weight, are struggling to keep it off, either with the injections or if they've done the weight loss naturally or whatever. Um, the ESG might still be a really good tool for us moving forward as
I
well.
think so. Yeah.
Less data about that, really no data about that, but again, it just kind of makes sense
There
to
are
me.
celebrities that are in your feed that do that. 100%. Yeah.
Yeah, yeah.
Yeah.
Hopefully, people start
It's
talking about.
and it's a nice tool for that because it's very safe. It's very
Yeah,
well tolerated. There's no incisions. So,
absolutely. And I don't know much about the pricing. I don't get into the pricing much, but I will say like we're thinking about remodeling our kitchen, and we reached out, and we don't know what we're doing, so we reached out to an interior designer and asked like if you were to help us just with the design, how much would that cost? And it is almost the price of our ESG. And I was like, I have spent a long time training and doing all of this stuff, and it's the same price. That's crazy. Or it's not quite the same price, but almost. I was shocked,
yeah.
shocked, shook.
Yeah.
So
It's crazy like from a price standpoint. It is like a for the price of about a bathroom remodel, you can change your life.
I think it's less. I think it's less.
Yeah,
Having
it's true.
started to like look into these things, I think it's
Maybe bathroom model in
maybe
2020
bathroom is.
2018. Yeah.
Oh my gosh, crazy. Anyways, all right. Let's see. And what do you how do you counsel your patients beforehand um, in terms of getting ready for the ESG? Is there anything that you kind of typically do with patients? What's that process look like?
Yeah, I really tried to set them up for success, which means counseling them that this is a tool, not a cure, not a magic wand. And just like any tool, you want to have the right skills to get the most out of the tool. The two most important skills I believe there are for any weight loss procedure or weight loss in general, measuring your portion sizes, like being very intentional about what this is, and then tracking your food. The reasons for that is we're going to address some of the reasons, of course, of like, why do you eat? And what these tools help us with is they really help a lot with the biological component of like, I'm just hungry all the time. My body's kind of like driving towards food. And these help that a lot to like really get that under control. They also help on the back end a lot. And this is where the surgeries and the procedures like the endoscopic sleeve, the gastric bypass, the laparoscopic sleeve, they're really good in the sense of why do we stop eating? Like it gives us much smaller stomachs, so it's just like, oh, I can't put any more food in there. That's going to be the answer for that. But I mean, think about the millions of food interactions you've had with your body. Most of the time, people eat until they feel full, like until they're sort of stretched out. And what we want to do with this journey when we're trying to reestablish a healthy relationship with food is that we need to say, like, hey, I really want that. I really want my stop sign for eating to be a portion size where I'm shooting for about 70 to 80%. And I listen to people that have a lot of experience with this. And I trust the process. And I say, I'm going to have my portion size that they tell me to. And it kind of goes in a progression. And then I stop there. And I'm not chasing this feeling of fullness. I think that chasing a feeling of fullness is long term a setup for is not a setup for success. Um, so that's why I want you to start working on that, grappling with it, kind of working that into your routine a little bit. The portion size piece is really hard, for a lot of people, and it's very different. And but it's good to quantify that. Take the measurement, put it on your plate. You'll really start developing an eye so that in the future, for this journey to get the most success, the portion size piece is really helpful. And then for the future to maintain your weight, being like, hey, I have this amount, these healthy types of food, which is why I think the tracking is good. It really helps you make good decisions. Um, and I have this amount, and then I'm good. And I don't wait for this feeling that I'm chasing, and that feeling comes from like your lizard brain telling you you need to eat as much food as possible because the winter's hard and you're gonna die. So
Yeah. And that is like that's a new, or I would say that's a unique approach here at Aviva, like at our clinic, because that's not something that I really counseled folks about until I started here and kind of heard how you were approaching this, because and it totally makes sense. It's kind of like retraining your stomach, right? We've changed the anatomy of your stomach, but we have to treat it in a new way too, right? Otherwise, your stomach's gonna stretch out. It naturally stretches anyways, and so it's a matter of like retraining things, and it's a perfect time to do it after surgery. And once we've retrained your stomach, then it becomes easy long term. And the tracking piece, it's like everyone hates tracking. Well,
everyone hates. I hate tracking. Yes.
Some people like tracking, which I'm like,
God bless
good for
them.
you.
Yeah.
But it's very rare. Almost no one likes tracking, but it's so important. And just know that it's not something you need to do forever. You don't, you don't have to, but it's a good thing to like set practices initially. It gives you feedback about what you're doing. A lot of people are surprised when they're tracking about the things that they are or are not doing. And then you don't have to track long term, but every time you feel like you're hitting a wall, you're plateauing, you're struggling for whatever reason, the first thing to do is go back to tracking. It's just it resets things. It kind of helps you reevaluate as well. So
well, one thing I tell people, like even before tracking though, like you can't track accurately if you don't know the quantity.
yeah.
So people are always here's the other discussion. So do I do the scale or do I do the volume?
Oh,
I say we're in the
ooh.
and area. Why don't we do both? Watch this. Check this out. Right? We got our portion size. We got our scale. Like, oh, I'm gonna have some delicious food. Oh, and my lunch is upstairs. It looks like. But I caught a lingcod this weekend, and I have some of that for lunch, which is I'm pretty pumped
Whoa.
about. Got my scale. Put this on there. Tear the scale. Right? And you're like, oh, okay. Here's my thing. Put your food in there. Okay, 2 ounces of lingcod, 2 ounces of lingcod, put it in my little tracker, tear that, put it in my little, like, oh, I got some vegetables over here, some carrots, okay, do that. Good to go. Got it all fits in here, plop it on my plate, good to go. That way you accurately you actually have an accurate measurement of how much you're actually getting. You don't overshoot your portion size, making sure you can pack it in there, that's fine. But make sure it's just not over the top of this, so.
Yeah. That's your and era.
I know, right?
Yeah. I mean, I probably lean. I prefer measuring if you're gonna have to do one. Just the volume.
Yeah,
is
the
nice.
volume.
I think it's a nice thing. But if you weigh things, that's even better for sure.
If you do both, it's sweet. Because you're exactly right. Doing that for a season will really help you reestablish what these tools help you do is reestablish your relationship with food and really rebuild a new menu of things of like, these are healthy choices I want to make as a regular part of my life. They're on my menu. for the different, episode lunches and dinners and breakfasts. There's also things that and that's what's cool about this journey is that you don't have to give up everything. You can still have some birthday cake. You can still have this. You can still have that. We're just gonna be like mindful of this is just something I'm not gonna have as a regular routine thing. It's gonna be, something that is a little more special, and it's just not a regular part of my diet because that's what I need to do to to keep my body healthy and to live a healthy life. That's what we do for our animals. Honestly, we're like, well, I can't feed too much junk food to my dog because otherwise they'll get unhealthy and be bad. And we're like, but we feed it to ourselves all the time. Like it's about kind of reframing the things that we need to do in the 21st century to be successful with our
Yeah.
health and with our weight, managing our weight. So
Yeah, yeah, yeah. I mean, and it's, this is a huge thing after surgery is just resetting, or even just like healing our relationship with food afterwards, right?
mhm,
Food is nutrition and not necessarily as a coping mechanism or as a stress relief or, a boredom relief or something along those lines. And so that's where a lot of these tools are helping us is again, reframing food as nutrition and fuel and not just as, again, all those other things that
mhm.
we've kind of been conditioned to use food as. Um, all right.
Which, I tell people like it's your body's normal instinct to go to food for a lot of things. That was a very good instinct for most of human history
Absolutely.
because
Absolutely.
life was really hard. Like life was generally really hard for all of human history, and we needed all the calories that we could get. Obesity is a very, very novel thing when it comes to at the scale that we're seeing. Like it's never before been seen in the history of humanity that we know of. So,
Yeah, yeah. I mean, I won't get too much into it, but our food supply too. I think that instinct that we have has really been taken advantage of.
co-opted
Yeah,
for sure.
yeah,
Yep.
yeah. So
Hacked,
it's
if you
just
will.
so much. There's so many things out there that are so addicting. Yeah,
Sugar, salt, fat, we're all generally extremely rare.
yeah.
Um,
Uh,
all right. I got a couple other submitted questions. Do you have some you want to hit?
I don't have anything on my end, but
Okay.
yeah.
Questions from a patient that got submitted this week. Actual data about weight loss of patients post lap sleeve and post endosleeve. Great question. What we see in our practice right now, we're just going through our data actually currently. Excited to get that all officially going, but and what we've seen for years, honestly, and this is consistent, fairly consistent, which is our endoscopic sleeve at 1 year and about at 2 years, the average is about 21, 22, 23% total body weight loss. That's all comers. So it's not, what does that mean for a specific person that's you listening to this? I don't know. It's hard to say because everyone starts their journey a little differently. Everyone takes the tool a little differently. But the average is what the average is, and it gives us a crude indicator of how these things compare. And it's 21 to 23% total body weight loss, which means that from wherever you're at right now, when you start the process, you lose about a little bit more than 20% on average. The laparoscopic sleeve is usually around 30% total body weight loss. And usually we're seeing that preserved at, about 2 years. Most people are seeing that preserved as well. What's very interesting is as we've added more GLP-1s into our practice, our 3 year data, which usually has dipped a little bit, like you kind of lose some of that progress, our average has gone up, which is crazy, which is
Great.
super cool. So, yeah, that I think that's really important numbers to understand. As context, a medication like Ozempic, what we see in our practice and what most real life data is like 8 to 9%, sometimes 10% total body weight loss. Manjaro or tirzepatide or Zepbound, that medication, which is a GLP-1 and a GIP, a two hormone, GLP-1 medication, usually works a little bit better, but it's still in like the 14, 15%, maybe an 18% total body weight loss average in one or two real life studies. Is what we generally see, which is good. That's like definitely the best medical weight loss medication we've seen before, but
Very good. Yeah.
it just isn't as good as the drugs as the surgeries are. It's also like 50% of people don't keep taking it long term, and of those, only a minority of people are able to maintain their weight that they lost. So
Yeah, definitely pros and cons with all the different tools out there.
Yep. There's no perfect tool. They're just trade-offs. This patient asks, what's the time frame from when I'm thinking, like when you do a consult to when you could potentially be at surgery? Great question. Also very individualized, but we generally do at least a set of labs before you do a procedure to make sure that everything is safe and that you're good. You know, you're safe to go undergo anesthesia. If there's any other workup things, they may take a little bit of time to get them done. Then we have, but usually the fastest we get people to a procedure is about 3 weeks. But usually it's in the realm of like if there's no other barriers. But it can be in the realm of, but the average is about 4 to 5. So from when you're like, hey, I'm ready to go, I'm generally healthy, I don't really have any other things, you know, like most people come see me, they're like, can you just take my money and do my surgery yesterday, please? Like, so and I say, well, let's make sure that we're, you know, let's do all the steps. You know, we've been doing this a long time. We understand that this is a process, and this is really in your best interest to help you get the best outcome. So you have nutritional counseling ahead of time. You have more visits with either of us. We have a pre-op visit again where we kind of go over nuts and bolts about how to use this stuff, and trust me, like in everyone's always super anxious to get it when they first show up, but you know, like just a couple extra weeks, we're gonna be great. You won't even remember this, you know, in even 3 months, 6 months time. So
Yeah. I mean, it's such a big life change that we're talking about. I think those few weeks is really good for processing. So, like the way that our clinic is set up is that you meet us first, your surgeon first, and then you're going to meet with the nutritionist. And everyone thinks that the meeting with the surgeon is the most important. That is actually not true. It's the meeting with the
yeah,
nutritionist. I mean, that's where they teach you this is how you are going to eat. This is how your life is going to look after your surgery. And so you need a little bit of time to process that, and you even start practicing that before surgery. And so, you know, I think it's good that we have a little breathing room between first meeting us and
yeah,
actual
yep.
getting in the door. Yeah.
The pre-surgery diet out of Viva. This is kind of, we talked about a little bit about this before. So before any of our procedures, we do a liver shrinking diet. The purpose of that is the liver sits on top of your stomach, and so if it's really full of energy, like if it's a good store, the liver is an incredible organ. It does a lot of really cool stuff. It filters your blood, fantastic at taking toxins out of it, but it's also the major short-term energy depot of your body. And so what we do is we actually want to get you into a little bit of a calorie deficit, and also it loves carbs. Like your liver loves carbs, which is why alcohol actually affects your liver so much, because it's number one a carb, and number two it's a toxin. So your liver really takes it for the team when you're drinking lots of alcohol. That being said, so we're going for about 12 to 1600 calories a day, and then about 40 grams of carbs or less for 2 weeks to try to get your weight loss going in the right direction. Shrink that liver down a little bit so that we have the most amount of space to do the best and safest surgery possible.
Yeah, shrink your liver right up. That's good. And people might ask, I don't know if people might ask, but for the ESG, you might think that since we're not in the belly, the liver isn't in the way, but it does. You actually can see the liver internally from the stomach oftentimes,
Yeah,
and so
you'll
having
see it
that
on
out
the
of the
roof
way.
there, kind of
Yeah,
pressing down if it's big and thick. Yeah,
yeah. So a lighter liver is always helpful,
yeah,
regardless of how we're doing this.
yep.
So
And also, usually this stimulates a little bit of weight loss and gets your cells, all the cells in your body run on some type of fuel. And for most people, that's a pretty carb heavy source of fuel. Also, a lot of people's fat cells they're used to just receiving. They don't give. Like they are takers, they're not givers. And giving, they're different cellular reactions actually. They're different chemical reactions. And so receiving, you know, energy and turning it into a fatty acid in an adipose cell is a different process than turning that adipose, then those fatty acids into usable forms that it can then of energy that it can put into the bloodstream that other cells can use. So we want to get that process started a little bit of jump starting the different fuel cells, fuel, you know, content from your cells being used in different ways. And we want to get your fat cells actually tuned up a little bit so that they're ready to start dumping some stuff into the bloodstream to make up for, you know, for our goal here, which is to shrink your fat and to help you live a healthier life. So, all right. Any physical restrictions? after the procedure? Any of our procedures. What do you
Oh, with
tell
any of
patients?
our procedures. Not really. Okay, so I would say with any of our laparoscopic procedures, the main physical restriction I have for folks is no heavy lifting. And I say 10 to 15 pounds, really kind of the weight of a gallon of milk. You want to avoid any lifting there and really any like core exerting exercises. And that's mostly to help reduce your risk for hernias at those incision sites. It takes about 4 to 6 weeks for those to be maximally strong and healed up. So you want to avoid any complications from that standpoint. Um, and so even like getting out of bed, you want to be a little bit careful of in terms of how you're doing that. Um, but otherwise, really no other physical um, limitations there. Cardio, you can kind of slowly work your way up on that. You're not going to want to go on a run probably like a week afterwards, but again, you can slowly work your way up. But the ESG, really, then no, I don't really have any physical restrictions for anyone. Listen to your body. If it hurts, it's your body telling you to slow down a little bit, but no hard restrictions other than just the eating kind of advancement that we teach you afterwards. Yeah.
I recommend the rule of 60s for me, which is like
60s.
60 grams of protein, 60
Yeah.
fluid ounces, and
Oh.
then go 60% speed of what you're going to do before.
60% speed. Yeah.
Yep. So go
Yeah.
go 60% intensity, 60% the duration you would do otherwise, because you're gonna feel, this is the way it always feels like, you feel good, you're like, man, this is awesome, I can't believe how well I'm doing. And then you're like, you're going and you're like, wow, I am out of gas. And that what that is that your short-term energy storages are being depleted, and your fat cells, which are going to make up the difference now, they're just not tuned up yet. They're not, that pathway from storage into usable material for energy, it's like an overgrown path for most people. It's not the highway that it needs to be. It just takes a little bit of time for it to turn into a highway. And that's where you're going to need several weeks for that cellular biochemical machinery to be built up. There's enzymes, there's cofactors that need to be in place for those chemical reactions to happen. And so what happens is you run out of gas, and you're like, I just need to take a nap right now. And you do, which is fine. That's good. That's why we have the recovery part.
It's there's always a phone call that I get like 10 days to 14 days out of surgery where people are like, I was feeling good, and then today I just feel awful. And I was like, well, what did you do yesterday? And it's
Yeah.
always like, oh, I went to the park with the kids, or I went grocery shopping for the first time, or I did this thing, And it's like, well, that's probably why.
Yeah.
You're going to feel good tomorrow, I bet.
Yeah. Yep.
So.
It's you just got to catch up. So.
Yep. Yep.
This is a different one. I hadn't heard this one before.
Okay.
I've heard discussion about the lap sleeve cutting the vagus nerve and how that impacts weight loss.
Oh, yeah. That's a very interesting question, actually. And it's been done before. I don't know if you've like seen somebody where they just take the vagus nerve and see if it helps lose weight. People don't really lose enough weight with the vagus nerve.
There was those vagal nerve stimulation things. They actually had like pacemakers that they would put on
Yeah,
the
yeah,
vagus
yeah,
nerve
yeah.
and
Yeah.
to vagal stimulation, or negation. I wasn't even ever sure. It didn't really seem to pan out. So
Yeah. I will say from I actually did a little bit of this in fellowship where we would take the vagus nerve for GERD reasons.
yeah,
With a bypass. Like if we were converting a sleeve to a gastric bypass, we'd take the vagus nerve sometimes to see if it helps. Which maybe it does, maybe it doesn't. I did a couple of those to see if it
when I heard this question, I actually did a little bit of a literature search, and I didn't find it was like, yeah, there's not really anything very conclusive. There's no really strong data one way or another that one thing is better than another. In my experience, I haven't noticed a difference whether you take the vagus nerve or not, and very rarely do we ever even need to in a laparoscopic sleeve. Like if you do a hiatal hernia repair, we still don't really even take the vagus nerve on as a routine thing. But yeah, so.
Yeah. I mean, there's potential side effects that you run into with taking the vagus nerve, which are often negated by doing the bypass. But anyways, yeah, it's
Yeah.
it's definitely. Usually we try to keep them.
We do. Yeah, usually we try. Generally we think, except for that extra part of your stomach, which is just trouble. We don't need that. That's nothing. That's not necessary. The rest of the things were like, generally like less is more, you know. So
Um, well, one thing that I think we should hit on maybe with the ESG before we finish up is since the ESG is a newer procedure, really most folks haven't been doing it for more than the last couple of years. What do you feel like is next on the horizon with the ESG? Do you feel like there's going to be developments, new things coming up?
yeah,
There's been a lot of talk about, there's always talk about the ESG here and there that I hear, but I don't know
yeah.
how.
The biggest thing on the horizon with the ESG that's going to really be a big part of its story is insurance reimbursement. And I think in the next 12 months, we're really optimistic that we're going to start being able to get insurance coverage for the endoscopic sleeve, which will be fantastic. That will change everything. Then we have a new problem, and that is making sure that it's only being done by people that actually are good at it.
Yes.
Because otherwise it's going to hurt it for, I mean, there's just going to be so many people that get a need an endoscopic sleeve, and it just won't be up to the quality that it needs to be, because it's a challenging procedure to do. You cannot go into that thing with just magical thinking like I'm just going to put a couple sutures into the stomach and I've done an ESG. It's just like a laparoscopic sleeve. Doing a laparoscopic sleeve well and safely is an art. There's a reason why people specialize in doing this, because it is it takes you want to do this well, and you really want to do it ideally perfectly. So that's going to be huge. I think Dr. McGowan is kind of pioneering the mucosal ablation. I think that'll be really interesting to see. I think his data has shown an extra several percentage points benefits from a weight loss standpoint. I've always liked the idea of that so far, and it's cool that he's pioneering the way there. As of right now, our endoscopic sleeve does get really good results. Like we're pretty much we're like right there already. Where I think the really cool thing is going to be is like adding a GLP-1 plus an endoscopic sleeve
Yeah.
as a standard, like, and just kind of doing adjuvant therapy stuff, which is going to be we already see it be really really helpful and really get people that extra percentages that I'd really like to avoid, like doing extra cautery, or the more extra things you do procedure wise, the more things can go wrong.
Yeah.
And so I love trying to do things perfectly. I love trying to get things, really, really good results. But it is a balance of the more things that you do from a procedure standpoint, the more complexity you add to a system, the more things that can go wrong, and the more things that can go wrong just makes it affects people. So the nice thing with the endoscopic sleeve, the ones that we do, is that they work really nicely. Plus a little bit of GLP-1 that also works really nicely together. It's awesome. They're very safe. They're very well tolerated.
Yeah. 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 I think the insurance coverage is going to be huge. Um, it'll just give access to so many more people to a really cool tool. And then I think yes, quality of the ESGs being performed is going to be a big thing. And that's probably not something that patients are privy to, unfortunately, very often, because you just hear about the ESG advertised and there's really no standardization of what an ESG is, which is kind of scary in my mind. And you'll hear a lot of things now about how the ESG is ineffective or it's a scam or, all these things on social media or wherever else. And I think that doesn't come from a wrong place because there is variation in terms of the quality of ESGs. And so I think the messaging that we need to be giving to patients is that they do have to advocate for themselves a little bit. If you're meeting with a surgeon, you want to ask, how are you doing your ESGs? How many sutures are you putting in? Because it's
Yeah.
very different in terms of how many sutures you'll hear about surgeons or GI folks putting in.
How many
And then
have you
what's your
done?
aftercare too?
How many have you done?
What's your follow up with folks? Because that's also going to be very variable potentially as well. So, you, I think if you're looking into an ESG, those are things that you probably want to ask about, do a little bit of research on ahead of time.
Yeah. Absolutely. Cool. Well, some good questions today. Thank you everyone who's tuned in.
Yeah. All right. Yeah, that's everything I have on my end.
Yeah, me too. So and we're at time too, which is perfect. And thank you everyone for tuning in. I'm Dr. Vanderwell. This is Dr. Tan. We're at Aviva. I don't know if you can even see that actually. That's cut off or not. But yeah, I just.
Well, you have it on your shirt. You have it on your
That's
shirt.
true. I got it on the shirt. Yeah,
I
I
have
got
my
it on the
mug.
shirt at avivamd.com. Yeah, no, I made that. I'm proud of that. So yeah.
Exciting. Yeah.
I make these.
I made these for you.
So thank you all for tuning in. And if you have any questions, you're welcome to put them in. Reach out at avivamd.com. We're always happy to help people. That's what we love to do. It like keeps us up at night. And we really want to see you succeed and live your best life and be healthy and happy with the direction that your life is going from a weight and health standpoint. So thank you all for tuning in and have a good time. We'll see you in. We're going to do another one of these in at least a couple weeks, and we'll go from there.
Yeah.
So.
2 weeks or so. Yeah. All right.
Yep.
Bye.